Is it required to replace a bridge that's been done long number of years back? The question asked by one of the subscribers. To address that question, I thought we can actually present an X-ray and then explain when is it required to replace a bridge. This is Dr. Arun from Pearls Dentistry, running our dental centers at Chennai, Raja and Amalpuram since the year 2001. If you have not yet subscribed to our channel, please do subscribe to our channel. We're coming up with a whole bunch of video in this year. So now let's look at what a bridge is. Bridge is basically, we have a tooth that is missing. Because the tooth is missing, we prepare the adjacent two teeth and then make a crown for this tooth, and then fix the crown. So of course they've seen in our previous videos it can be made of multiple materials. So this bridge usually lasts for a very long number of years without a problem. So now the question is, should we replace the bridge? Say it's 10 years. Should I replace the bridge if it's 10 years time? Technically speaking, if it is 10 years time, there is no fixed date to which this bridge will last. It can last for many more years also. So it's not required to replace the bridge unless and otherwise there is a problem. Now, how do we identify a problem? First is, the patient can have a pain on the tooth under the bridge. That is one problem which the patient can experience. If there is a pain, there is some infection that is going on under the tooth which will necessitate a replacement of the bridge. 2, there can be an instance where food is getting caught because the gums are receded. So that is another instance where we need to change the bridge. In all these cases, what we do is we take an X-ray. So now this is an X-ray of where a bridge has been done. This bridge has been functioning in the mouth for many years. Now if you look at this bridge, I'm trying to zoom in on the X-ray here. This is a bridge that's been given on a tooth which is not root canal treated. If you look at here, under this bridge there is a small black triangular space here where this mouse is being pointed there, and there is a very small space there. Now this black triangular space shows that there is a decay that is developing under the bridge, and the decay that's developing under the bridge is created the tooth to get lost there. Now this is a clear indication that the bridge needs to be replaced, because if we don't replace the bridge, we might not only lose the bridge, we might lose the tooth itself. So to answer it short, if the bridge is a stable replacement which can last for many number of years, if there is no symptomatic problem or there is no X-ray finding that is going to show that there is an issue, the bridge need not be replaced. But either if the patient experiences pain, discomfort, food lodgement, or the X-ray shows a decay process under the bridge, then the bridge requires a replacement. Where we remove the bridge, take care of the decay that is there, and then make a new bridge. I hope you like this video. If you like this video, do hit the like button. If there are any questions, please do ask in the comment section below. We'll be happy to answer. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.
லைக் பட்டன் கிளிக் பண்ணுங்க, சப்ஸ்கிரைப் பண்ணுங்க, பெல் ஐகான் கிளிக் பண்ணுங்க. இந்த மாதிரி வீடியோஸ் உங்களுக்கு வரும். தேங்க்யூ.